Do you mind standing? How do you feel about all this? You've been married for?
Let's see, 26 years.
Well, you're doing something right.
Yeah, I am.
Yeah.
Oh, yes.
Well, what do you think about all this? You know what? The point is that we're all so conditioned to perform certain roles. See, you're holding hands here. This relationship has some merit.
I'm nervous.
So how do you feel about it? Anything?
Well, so many men talk about it. They won't be masculinity. My God. I'm nervous, Phil. Get somebody else to help you.
No, don't you feel, though, that it's possible we've narrowly defined the roles that we're supposed to play? You do. You have children?
Oh, yes.
And
grandchildren.
Girls and boys?
Oh, no, just girls.
I see.
And grandchildren and boys.
Were they raised to feel that, there's sort of, you have to have a man there attached to the side in order to be somebody?
Well, what's wrong with that? I love men.
Yeah.
I don't see any problems. Anything wrong with that?
I think that if there's anything wrong with it, it's only that both the traditional feminine role and the traditional masculine role severely limit what you can do and say. Like little girls are brought up, they were brought up. Now a lot of this is changing. They're not supposed to be too aggressive. So consequently, when it comes to dealing with angry feelings or to go get what they want, there's problems there. They're not supposed to be too assertive. You're not supposed to be pushy. And so many women literally run on empty. You take them on a date and you say, where do you want to go? What do you want to eat?
Wherever you want to go.
She says whatever you want to go, right. When it comes to sexuality, most women feel that sexuality is really a kind of a gift to a man that they love. And there's nothing wrong with that, except that they don't really own it as a need of their own. And this creates a resentment to the male's sexuality because they see this guy as being an animal who always needs it. And they, in fact, the traditional couple have what I call sex at cross purposes. She wants to be held. She wants to be cuddled.
Yes.
And she says, the sexual act is not so important. I'd rather just be close to you.
But if she hugs
him, he says, the sexual act is important. When can we stop holding already,
Well,
So...
But not only that, she can't hold him without having the message misunderstood by him.
Exactly, and they're having sex at cross purposes because in his childhood, little boys were learned that sensuality is feminine. In other words, we rock and kiss and stroke and lick and cuddle and stuff little girls, no matter how old they are. But little boys who want to be cuddled and held and stroked when they're 6, 7, 8 years old are suspect. Likewise, the girl learns that sex is, women are not supposed to be too sexually driven. But she learns that touching and holding and love is okay. So you're having two people in a relationship, one who thinks sex is not so good, but closeness is wonderful. The other one who thinks closeness is not so good, but sex is wonderful.
That's a huge generalization.
Yeah.
All right. The minute the woman makes an advance, or the minute the woman feels that she is able to be just as sexually oriented, sexually open or whatever, she can turn him off, too. He can't accept it. He can't handle it.
Let's make sure we understand your question. In other words, you feel that a woman can back up from passion easier than a man?
No, I didn't say that. I just felt you have put people in roles. You have defined them. You put them in boxes. Mm-hmm. The woman can be held and whatever, but the man must make the sexual advance.
You're suggesting that culturally that's what happens.
I'm saying what the classic conditioning is, and you're absolutely correct, which is that when a woman does nowadays all of a sudden get in touch with her sexuality, a lot of men are intimidated. The reason they're intimidated, however, is because they see a woman's sexuality as a mandate for them to perform. They don't see that, hey, she can be hungry to make love, and maybe I don't feel similarly, so I'll just be a little passive and let her take some of the responsibility. Or I'm still a man, even though I can't at that particular moment perform the way I'm supposed to. But that doesn't work too well yet in most men's heads. One, because they're not used to being just plain sensual, which is just to be able to just lay there and enjoy the contact, enjoy the closeness. They feel that every sexual overture is a demand to perform. That's where the problem is.
Let me just show you here's what's happening to men as a result, in your view, and in the view of many, many people who've taken a look at our culture today. Here, let me just show some of these graphics. Look at the average life expectancy of men and women. Isn't that something? You're spending an awful lot of time without us.
And that gap is increasing.
Yeah.
That's been steadily getting worse. In
It must be
1920, it was only about a year's difference.
And it must be so boring without us.
And
too.
by year 2000, by the year 2000, there's going to be a 10-year gap, and right now there's only 70 men left for every 100 women at the age of about 60.
We're saying that men's sex roles are killing them.
At the age of 60...
Somewhere between 60 and 65, there's only 70 males left for every 100 females.
All right. Look at this one. Men are 5 times more likely to be murdered, 3 times more likely to commit suicide, and 5 times more likely to die from alcohol-related death. Not only that, men are 4 times more likely to die from coronary heart disease and 4 times more likely to die from accidental death. Now, this is complicated, and you're right, we have to be careful of generalities, and sure, there might just be some physiologic, hormonal input here, but
You can't go in that direction, Phil. The reason being that in 1920 there was only a 1-year difference. By 1970 that had gone up to almost 8 years. In a 50-year period you had an 800% increase in male and female longevity. That couldn't be biological simply. In fact, if you look at masculine conditioning, you'll know why what I term masculinity being a blueprint for self-destruction. All the things that are life-nurturing are feminine. All the things that are body-destructive are masculine. So, for example, men learn what do they learn about pain?
to pretend like you don't have it.
Right, and the more pain you can take, the more manly you are.
You know, when I was a kid, when those big league batters got hit with a pitch, they never rubbed their arm.
Right.
They'd run to first base, and I'd think, tough.
It's interesting because you see that even in little boys and little girls. I was talking to one woman who had talked about the difference between her young 3-year-old daughter when she had an emergency thing in the hospital and had to have a wound sewed up, and cried her head off, and everybody kind of cuddled her and said, "It's okay, you're a sweet little girl." A while later, her boy was about the same age, and he had the same kind of thing, and he was sitting there, and he wouldn't cry, and he was only 3 years old. Guess what everybody was saying?
Baseball players don't cry.
No, everybody was saying, what a wonderful boy, what a strong boy. She was upset because she was more sophisticated and knew that it was dangerous for him to suppress these signals. She told her husband, and what did her husband say? "That's my boy." So the denial of pain meant, yeah.
I don't know whether it's necessarily completely understood in terms of the significance of this. So what? Why is this so important?
It isn't just baseball players. We're talking about men who don't stay home from work when they're sick. We're talking about men who don't go to the doctor when their body's beginning to tell them that they need help. We're talking about people not taking care of themselves. Our occupational safety and health record in this country is absolutely terrible, particularly when it's compared with other countries of equal industrialization. We're talking about a problem that affects everybody, not simply
Bill,
baseball players.
I don't know if you know this, but men almost never come to psychotherapy. As a psychologist myself, up till a few years ago, my practice, like most people's practices, was about 75 to 80% women. The reason being that even psychotherapy is in effect feminine, because it means you have to acknowledge you can't handle the problem yourself, you have to ask for help, you have to depend on somebody, you have to focus on emotions, you have to pay for something that's intangible. I mean, you can't drive it and you can't eat it. And you have to pay for something that doesn't have a clear-cut end point. You have to deal with the fact that you are in a one-down situation. The more macho the guy is, the more quickly he becomes anxious in the therapeutic situation and says, "I'd rather take a pill."
And we'll be back in just a moment.